let's see how our patient talked about. So this is the one Bill we just shared video testimony. His sugar level was over 200. Then in 16 days, every single day it dropped. 16 days later, dropped to 295. I invited him to my diabetes seminar. Before COVID, every single month, we invited one patient to give a speech about their experience. And today we have one just came 3 times. And she's going to share the end of the seminar. And this is Rani, and she actually is the nurse. And she only did, 2 months or less. But her A1C is dropped from 8.46 to 6. So the next one, the Hannah, and she was the one very interesting in the video, said like it dropped to 120 and it's not coming down. And I told her it will. And slowly, finally. And she said one thing very, very interesting. She said, once I don't obey my body, my sugar level will go up. That's one thing. So in the future, when you come to see me, we're going to teach you what to do. If you don't want to treat your body well, nobody else can do that. And this is Sumit. And he emphasized the lifestyle he learned from me, make him much better. And he could play tennis 3 courses instead of 1. He used to be tired, but now it's much better. So all this testimony, this is Shamish. We played today, very beginning. And he was pre-diabetes, ready to take medication. The hard case was for his mom. And this is Gilbert. His problem was 4 medications. He was suffering from all the side effects. So in 1 month, he stopped all the medications and still have better sugar level. And this Shamish again, actually, he was talking about his mom, who was 79 years old that time. And his mom sent to emergency 12 times in 2018 because of sugar level. And we bring it down in 6 visits and stabilized around 130. So all this one, if you want to listen to the video, feel free to send us email requested. So we're going to start our seminar. I'm Dr. Yaron Wu. My clinic is in United States, San Francisco Bay Area in the New World. I've been specialized in type 2 diabetes for 5 years. I used to treat a stroke, pain management, everything. My last clinic was 5,000 square feet, 17 staff, over 1 million gross income. In 2016, I closed down the clinic because I feel my practice or my Chinese medicine skill get to a level. In Chinese culture, it's 99 steps, but the last step, I couldn't achieve it. So went back to China, Taiwan, Malaysia, visited a lot of acupuncturists, herbalists. I thought I was top one, not surprised. But at the same time, I did learn some new thing. And in 2018, I come back, developed tension release. And one of my patients I knew more than 25 years in my church. From his case, because he was a diabetes patient, followed me for years, I found out tension release was the best for insulin resistance. Then the next month, 4 patients with diabetes came in. Every single one was excellent outcome. So from then on, I said, I'm going to do diabetes. Tell everybody a little bit of story about me. The very first case I treated diabetes was around 26 years ago in 1996. I graduated in 1993, 6 years program for Western medicine and Chinese medicine. My classmates, boys are mostly surgeons, girls are acupuncturists. In China, I have to learn both, but I can decide, you want to approach which career, up to you. So I was very successful with treating stroke patient with scalp acupuncture. So my grandpa got a stroke. So I went back to my hometown and treated my grandpa. 10 days later, he was okay to walk around. So he told me, he says, grandson, you're great. You graduated from Beijing in China, every university, that's the best in Beijing. So the next door, actually next bed, in the same room, they stay in the hospital 10 months together. And this is like buddy. That blue worker, retired guy, has diabetes, can treat him. That time I just graduated from medical school 3 years. It's impossible for me or know how to treat diabetes. I said, no, I don't know. All my acupuncture herbalists or Western medicine professors, nobody knows how to treat diabetes. And my grandpa keep on talking to me and say, like, I know you charge a lot, but for him, he's my buddy. If you don't want to treat it, I can pay it. I said, no, it's not. I don't want to treat it. It's not about money. I'm not able to treat diabetes. Finally, the guy said, do you mind treating my constipation? I said, that I can do. But can I go bathroom? I did 10 times acupuncture, very gentle style, stimulate on the neck and the bottom of the back. 10 visits later, his insulin shot from the highest dosage dropped to the minimum. He lost 80% vision because diabetes, 60% was back. Not only he was shocked, I was shocked too. And his sugar level was from 200 something, come down to 150. I knew I did something, coincident, but I didn't know why. Until a couple years later, I found out. Well, I stimulate for the guy for go bathroom, which is parasympathetic nervous system. We're going to explain later today. His whole body start coming down. We are sympathetic, which make your body fight or run, excited. Your blood sugar go up, your blood pressure go up, your body temperature go up, but only when you stimulate the parasympathetic, which is make you calm down, fall asleep, go bathroom, want to have sex, you relax. Then you can go bathroom and the sugar level drop. So from then on, I believe there's a way to treat diabetes. I learned from 5 herbalists, more than 10 acupuncturists. All the time I treat diabetes. As I told you, I even own a stroke unit because my grandpa in my hometown, 2 years only treated stroke patient with acupuncture. Well, I came to San Francisco in Tunnel Rehab Center. It's a rehab center for 5 facilities around hospital. All send the stroke patient to there for rehab. 100 days, nothing improved, they sent you home. I walked in there, $300 per visit in 2004, treat a stroke patient. Every day, at least 5 patients. But finally, I figured out why I quit to treat a stroke patient. If you don't treat on the cause, the underlying issue, the cause for stroke, like diabetes, they'll get a stroke again in 2 or 3 years. Until 2018, I was very confident to treat stroke patient. Before that, 6 months program, 3 times a week. 6 months later, let's talk about your A1C. Within 6 months, nothing guaranteed. You want to see me? That's it. You don't want to see me? I'm fine. But now, before COVID, in 3 months, we had dropped most people blood sugar level. Now we can drop people's sugar level in 1 month. I'm pretty appreciative for the pandemic because I have tons of time to study and learn more about it, diabetes, nutrition, everything. So we're going to start our seminar. I'm going to share my PowerPoint. If you have a question, feel free to put in the chat, and we're going to answer at the end. So this is a phone number, 408-480-2860. We're located in Newark, California. If you want to come see me, feel free to text me for an appointment. The phone number is a cell phone, so it's easier to contact each other. All this information is let you know there's another option to treat diabetes, type 2. But we not try to tell you or replace your MD's position. So that's one thing I have to tell you. So first, thank you for coming here. Second thing is, I want you to know, I'm so excited to push my battle line from the treat a stroke patient to treat diabetes. In another word, we try to prevent your heart attack, kidney failure, stroke 10 or 20 years before. So that would be something I feel as acupuncturist, I'm so proud of it. For any physician, doesn't matter MD or acupuncturist, herbalist, I told them I treat diabetes, everybody's wow. So I had a big name in the past from my patient, but now I try to build up my reputation among physicians. So we have a way to help you to help your diabetes, get rid of the symptoms. And I'm going to share a gift at the end, give you a free consultation, which is worth $300 in the regular visit. And you can ask a question with chat. If I didn't present in this seminar, the end I'll answer. So at least finish all the information for everybody. My name is Dr. Yaron Wu. I'm licensed in California. I have been practiced 32 years. I have a doctorate degree for acupuncture medicine. I have a 6 years training in China, Beijing, the best acupuncture college. But my degree is for double degree for Western medicine and acupuncture. But how I can become a great acupuncturist is because I've followed so many masters. 5 masters for herbalist, like impulse reading, learn how to prescribe herbs. Herb practice like Ayurveda is the biggest in China, not acupuncture. Herbalist is considered as MD as well, but just one use herbs, one use drugs. All these masters have taught me how they treat patient, so I could have a shortcut. So like boxing, you don't go to school to learn boxing. You follow Tyson. If you can survive in 2 years, you're good. So that's how I learned my acupuncture. Because my accreditation, my school, my acupuncture, the name, the fame, I've been invited to Stanford, UCSF, UCLA, give a speech. Also to the big corporation like Apple, Microsoft, Intel, and I'm also a speaker for Bollywood radio. So by the way, if you can do me a favor, if you heard me from radio, please put in the chat, radio, or type 1. If you heard from friend, please type friend. So at least I know how many people from the radio. Before I start my seminar, one quick question. What is the thing brought you to this seminar? Because every time I have a consultation with diabetes patient type 2, seems like we are talking about different issues. If we're not on the same page, it's very hard to communicate. So for you, today you come to the seminar, for sure I know you have type 2 diabetes. That's the reason you attended. But you come here, try to find a solution for your symptoms, or you don't want medication. If you're on medication, like it's not natural, I don't want side effects, or you're worried about the complications. It's like timing bomb. You don't know when it will happen. I heard this, I saw my auntie, I saw my uncle, whoever have, kidney failure, heart attack, or you worry just getting worse. Actually, the real question is, do you want to put a patch on it, like drugs, to bring down the fasting sugar level? Well, you're good. Or you really want to fix the problem. You want to reverse everything to a point. You don't need to take any medication, but your sugar level is still perfect. Or you say, no, I not only want to fix my diabetes, I want to regain my health. There is a reason why it happened. I didn't treat my body well in the past, but I'm going to learn how to treat my body. I'm going to regain my health. I always tell all my patients, you're not married your wife or your husband. Listen to me. Your husband is not your first husband. Your wife is not your first wife. Your body is. From you were born that day, you're married to your body. When you have diabetes, is your body try to warn you, say, I'm going to sign paper for divorce now. I'm going to get a heart attack. I'm going to leave this house. So you're going to just fix the problem, keep the wife, your body husband, stay in the house, or you try to rebuild relationship. That's called health. That's my question for you. So I hope you keep that in mind and listen to me. If you have that idea, you want to put a patch on it instead of drugs, I use acupuncture. My number comes up. With the same drugs, it was 200. Now it's 120, but I'm still on medication. That's called a patch. Seems it's getting better. We'll just replace your drugs with acupuncture. Who can solve the problem? The sugar level come down to normal and no medication. Or you say, no, I want my energy, I want my sex drive back, I want my digestion, my sleep, everything back. If you have that in your mind, it's nothing to do with how much you pay me, how much you spend. It's how much you will gain for your life. So you have that one on the same page, it's very easy to talk about it. So this gentleman, Bill, we just listened to his seminar. We just listened to his testimony. Over 200 blood sugar level in 16 days, dropped 95. And if you want to watch his video, feel free, email us. So we won't spend time for all the testimony. But do me a favor, when your diabetes is getting better, I do want you to share your video testimony to tell other people there is something available, better approach, better outcome. Here's the agenda for today's seminar. Number one, talk about the reality for diabetes, which will show by your A1C. Second one, what will happen to diabetes? Diabetes type 2 is not worse to treat it because you feel nothing. With medication, with whatever, you can control the sugar level. You look like a normal person. The complications is the thing you need to prevent or stop. Then you say, doctor, I don't want it. Okay, as Chinese medicine or acupuncture, can you tell me why I get it? Every single one, when you come into my free consultation, I examine your body, you can feel the things. So today I have a lady who I do acupuncture. She said, every time you touch certain point, acupuncture point, I can feel that's wrong. That's something not right. How can you know? It's because I'm an acupuncturist. Your body has diabetes, you probably will have that issue. That's the reason we put it in to release it. Now we're going to talk about a clinic type, which type you are, because everybody walking is different. Even we know why the reason caused diabetes, but your treatment plan might be a little different. You might be slim, you might be overweight, you might have a sleep problem, you might be a mom at home with 2 kids, or you might be a VP, very stressful. Every single one is different. Now we're going to discuss that a little bit. And the final is your choice. You want to go to patch, you want to fix diabetes, we want to regain your health for a quality life. So that'll be the last part to talk about. The first thing is the reality for diabetes. What happened? So when we go see doctor, actually more than 80% people find they have diabetes because their annual checkup. You go see doctors and say, wow, your fasting sugar is a little high. Let's check your A1C. What A1C means? By the way, if you confirmed by MD, you do have type 2 diabetes, that's the test you need to do. Number one, A1C is a 3 months average your blood sugar level. Second one is fasting blood sugar level. If you want to come see me, you have to test it every single day. So I have a record to see it's getting better or you are sensitive to what kind of treatment. The third one is post-meal 2 hours, which means after you eat, once you finish the last bite, set up alarm, 2 hours later, test your blood sugar level. That will indicate how your body processes food. The sugar has 2 kinds. One's whatever in your blood right now. Another one is you eat the food today. Because the body try to process the sugar, you might stay eating a very high blood sugar level for 2 hours or even longer. 2 hours later, it's supposed to come down. For type 2 diabetes, a lot of people, the post-meal 2 hours won't drop, won't come down to normal. That means your metabolism is not able to process the food you're eating this very meal. So that would be one thing I highly recommend. If you join my program, you can test every day or at least every 3-5 days to see that one should drop too. And if your fasting sugar level is over 180, you should ask an MD to get a monitor. Is that a patch or something put on your arm? 24 hours automatic sync with your cell phone so you see a chart. So you can control or follow that blood sugar level, do what's going on. And the worst thing for type 2 diabetes is not high blood sugar level. Let me repeat it. For type 2 diabetes, right now, you don't need to worry about your fasting sugar level. If you're around 150, 180, you're okay with medication, with drugs, with acupuncture. But sometimes when you don't eat or when you use the medication or your sweat, your exercise, you might get too low blood sugar level. that can be life and death and very dangerous. So when you have cold sweat, you feel like weak, your heart palpitation, you need to know what's going on. That's the reason for anybody over 180 blood sugar level, you need to get a monitor. So we don't feel good, you feel weak, cold sweat, you need to check. Oh, is it 70 or 50, the blood sugar level? So I have one patient sent to emergency 3 times because low blood sugar level. But he is a diabetes type 2, over 200 blood sugar level with insulin shot. So that would be one thing I hope everybody know before we talk about it. So let's talk about A1C. What is A1C? A1C actually is 3 months average your blood sugar level, but how the doctor test it. And if you talk to any MD, they will tell you A1C high means life and death. So that's enough information on Google or from your MD to educate you, this is what's going on. So we're not going to say too much. But let me explain to you. Your red cells called hemoglobin will be created from your bone spur, bone marrow, come to your blood, red cells, join the blood today, brand new, fresh. The red cells will live around 90 days up to 120 days, but your blood has too much sugar. So the sugar in your blood will saturate it, soak the very new red cell. So it'll be coated by sugar. Whatever your sugar level today, for example, A1C is 8. 8 means 8% density of the sugar, boom, will cover the red cells. The red cells from born the very first day, 8% function lost. Okay, next day, you eat a lot of sweet, you go to a party, you didn't sleep, your A1C went up 10. Another new red cell joined because it's an ongoing process. The old red cell died, the new cells keep on joining. Just like a human population. Young guys always grow up, old always, gone. So it's 10. The new red cells join your body, join the blood. Tomorrow, boom, 10% sugar coated. These very red cells, 10% function lost on that moment. And any red cells be sugar coated is lifetime. Okay, you say, wow, I don't feel good. I eat too much sweet. I'm going to go sleep early, exercise, walk like 20,000 steps, and eat a salad only. Okay, your A1C dropped to 6. New red cell come in, boom, coated with sugar 6%. So now you have an 8, you have a 10, you have a 6. And the doctor tested 3 months later, up and down. So your average is 8 plus 10 plus 6. Then let's divide it 3. Okay, your A1C is 8. That's called A1C. It's a 3 months average. Whenever has been coated by sugar, red cells in your blood, they suck it up, then test it. That's called A1C. But if your A1C is normal, definitely your diabetes type 2 has been reversed. Because any days go up, A1C will go up for the last 3 months. Why red cells is so important? Because red cells carry oxygen from your lung to all over your body. Every single body cells, which is billions in your body, need oxygen to burn the nutrition to survive. So if your A1C is high, your red cells literally killed 6%, 8%, or 10% function of the red cells and cast less 8%, 6%, or 10% oxygen to your body cells. And your body cells will be affected 6%, 8%, or 10% as well. So your body literally dysfunction 6% or 8%. So high A1C means your internal organs, actually every single body cells are soaked in sugary fluid. Now what happened? If you know how to swim, you go to swimming pool, all the chemical make your finger wrinkle, right? You're swimming half hour, no problem. 2 hours later, you touch your fingers, all the wrinkles because of chemicals. That's exactly the same thing the sugar in your blood is doing right now for your body cells, for your heart, for your lung, for your kidney, for your vision, for every single body cells in your body. So the high A1C literally means life and death. In Sydney, the biggest hospital in Australia, their website, this is the chart I quote from them. Drop 1% A1C, the life death can be 43% different. 43%. Out of 5 guys, if their A1C drop 1%, 2 guys can avoid deaths from diabetes. And diabetes-related deaths, like heart attack, is not from diabetes, but from heart attack. But a guy have diabetes, drop 21%. Out of 5 guys, 1 guy can save life if you drop 1% A1C. And other thing like heart attack, stroke, 14%. Kidney failure, vision problem, neuropathy, 37%. Now you know why I have passion to treat diabetes, help people bring down the A1C. It literally can mean life and death. In the beginning, I'm just so proud I can treat diabetes type 2, bring down people's sugar level. One of my patients brought this chart to me. Said, Doctor, you're not only help us, you're literally saving lives. That makes me more passionate to see what I'm doing, to be proud of it. So another question is like, is pre-diabetes in a safe zone? No. This is Dr. Mark Hemman said. Pre-diabetes doesn't mean pre anything. You're already suffering and not allowing your body to optimal function. We're going to listen to his video for a few seconds, like 2 minutes. Let me get that one open. Very quick, but if you have pre-diabetes, I do want you to listen to this one and have an idea of what's going on in your life. Okay.
But most people think that the cause of heart attacks is high cholesterol. But you know what? It's not. Half of people who have heart attacks have normal cholesterol, but most people who have heart attacks have diabetes, which is the real cause of heart attacks. In fact, one study found that 2/3 of every patient admitted to the emergency room with heart attacks had pre-diabetes or undiagnosed diabetes, and almost none of them were diagnosed. Another important study found that the risk of heart attacks increases with any increase in your average blood sugar, even for those who don't have diabetes. That means even if you have a normal blood sugar, but instead of going up, you're at risk. And taking statins, the drugs for lowering cholesterol, and beta blockers for blood pressure actually cause insulin resistance and don't even correct this prediabetes problem. Many people believe that prediabetes isn't a problem until it becomes full-blown diabetes. It's just a kind of a warning sign. Nothing could be further from the truth. It's an earlier stage of diabetes, and it carries with it nearly every single risk of diabetes. Prediabetes can kill you before you ever get diabetes through heart attacks, strokes, and even cancer. Prediabetes even can cause pre-dementia. Prediabetes causes pre-dementia, which affects a lot of people. That's mild cognitive impairment. Think of it as early Alzheimer's. Recent studies have shown that diabetics have a 4-fold risk of developing Alzheimer's, and patients with prediabetes or metabolic syndrome have a dramatically increased risk of pre-dementia or MCI, mild cognitive impairment. So if you don't want to have heart attacks and you don't want to forget everything, try to get your diabetes addressed carefully and intelligently, and use a strategy that's going to deal with the root causes of the problem, not just papered over the medication.
Okay, I got a feedback like you guys couldn't see the video, but anyway, at least you heard about it, and we're gonna send a link through the chat. So we talked enough why A1C means so much to you, even you're pre-diabetic. Let's talk about what A1C really means to you when the complications happen. Again, you don't have to treat type 2 diabetes because I have no symptoms. 80% of my patients walk in the door, it look like they're normal. And I have close to a dozen patients told me they find they have diabetes because they're sent to hospital, heart attack. So it's like ticking timing bomb. You don't know when the bomb will explode, but once it happens, it's not able to reverse. Like heart attack, stroke, and once people get stroke, if you have diabetes, I highly recommend visit some friend or relatives or whoever has a stroke. You see that? You never want to get it. Because in the United States, once you got stroke, I never saw any family able to carry on more than 3 months. Everybody got exhausted. Money-wise, time-wise, energy-wise, they love you, but they don't need you. In India or China, at least you have some relatives can take care of you. In the United States, you know the lifestyle. Kidney failure, diabetes is the biggest contribution to kidney failure. And when I did my intern in the hospital, last 2 years in my medical school, kidney unit in the hospital has the highest suicide rate. Every single month, some patient with kidney failure jump off the floor. It was 16 floors. So in the beginning, they covered up with all the bars. Then they jump off from 15 and 17. They cover up 15 and 17. They jump off from 14, 18 floors. Finally, the hospital was complete covered with bars because the kidney unit in the hospital, kidney failure patient committed suicide rate so high. Another one's blindness. Diabetes, 80% patient vision problem is because of diabetes. Diabetes is the highest contribution to the adult on-site blindness in the whole world. And it can happen 7 years before you are diagnosed with diabetes. I have one patient told me 3 years before his vision is in trouble. And 3 years later, doctor says it's come from diabetes. He said, why? You don't tell me. You didn't tell me in the past. The doctor said, that time your sugar level was not so high. And now when look back 3 years ago, you have typical diabetes caused vision problem. And this, the right side two picture will show you when you have diabetes, how the arteries, the nerve get affected. Again, when you have type 2 diabetes, your sugar level is high, your whole body is soaking. So the kidney soak long time, kidney failure. Heart soak long time, heart attack. Your brain soak too much, get a stroke. Because all the things get wrinkled, just like our hands when you swim too long time. And the artery in the leg get in trouble, that's what happened. Either amputation or the bone won't get healed. And for men, diabetes not only cause all this thing, also cause you intimacy trouble. Again, the penis also soak in the sugar water. And lost sensitivity. For women, they lost sensitivity, but but they still can function sex-wise. But for men, it's done, it's done. So that will be another thing affect life quality. And also, we call PVD, the artery in the leg get trouble, can be blocked. And in neuropathy, if you shake hands with a senior, they don't want to try, they try to avoid it. They feel a million needles poking their hand from diabetes. That's the reason. So if you don't want it, you have to fix the sugar level now. And dementia. Dementia is the one somebody, they know nothing. Their life is still going on. But everybody else, the kids, the wife, the husband, whoever around the dementia, Alzheimer patient is in big trouble because they don't know anything. They can just walk away at last. They couldn't remember anything. Of course, it contributes to cancer. And any kind of place in your body has an opening, it can be an infection from diabetes. The older, the higher blood sugar level, the worse the condition. So all the right side picture has some kind of infection related to diabetes. Also skin or nail problem. So in a senior center, the people 80, 90 years old live in the assisted living or senior center, if they get nail cut, like right picture, and have a small wound, and 2 weeks later they're gone, they passed away. You know why? Because the small cut, the small wound, because of diabetes, the wound won't heal. And they get a bacterial virus infection from there. And because they're so old, the immune system won't respond. They don't have fever. They're just tired and lay in the bed. For that age, it looks like normal. But 2 weeks later, when sent to the hospital, they cannot breathe. Their lung, their kidney, everything. A couple of days later, because of that kidney failure or lung infection, they're gone. It happens all the time with type 2 diabetes patient, senior in the senior center. So that would be a horrible thing and scary. And if you heard PCOS, diabetes is a big contribution to that. Fatty liver, non-alcohol fatty liver, diabetes is number 1 contribution. So now the question, so many side complications. What is your choice? In my seminar, I always ask my audience in person, alive, what's your choice? One time, one guy raised a hand and say, maybe heart attack, just gone. I said, no. Unfortunately, the reality is diabetes patient, if you don't control your blood sugar level, you get 2 to 5 kinds of complications. Not your choice. Why no more than 5? Why no more than 5 complications? The guy is gone, dead. In the beginning, you don't know which one rule first because every single internal organs are soaked in the sugar water. Start getting wrinkles, the internal skin get in trouble, heart give up, lung give up, vision give up. Finally, everything give up. It's over, game over. And the bad news is most diabetic patients, if the complication happens, is one after another. In the last few years in life is full of suffering. And we do not want this for you. That's the reason I have a passion to share the seminar. I want to tell you why and how we can fix it. And you can decide your life path from now on. And we talk about it, health and disease. In Chinese culture or in Chinese medicine, we believe when you are in teenage, hopefully, genetic, you don't have any problem health-wise. We call you rich in health. 3 nights no sleep in college, take a nap, ready to go for final term or midterm. Okay, around 30, 40, you get up, tell your wife something, honey, I'm tired. Why? I have a project, I couldn't sleep last night, so tired. Are you sick? No. Do you feel good? No. Energy level is low. I didn't get a pay last night, so I have no energy to spend or no money for my health to spend this morning. Chinese medicine called weak. That's a very unique word in Chinese medicine. If you talk to a doctor, MD, I'm weak. Go sleep more, take a vacation, no stress. They don't know what's weak. And in Chinese medicine, and I believe in Ayurveda as well, we check your pulse, we tell your lifestyle, spending too much and not saving for your health. That's called weak. Then we come to 40, 50, you get up in the morning, oh, honey, my neck hurts. Why? It hurts like couple years already, but last night, yesterday I did a project 2 hours, my neck hurts again. You go see acupuncturist, masseuse, chiropractor, I feel better. A couple days later, you use computer 2 hours, and the pain come back. We believe like credit card bill. You pay back the interest, next month they send you another bill. It's called debt. In that condition, your health is not healthy anymore. You're having some symptoms called disease. Something stop function or not function perfectly already. Then at some point, you go see doctors, your cholesterol level is high, you have diabetes, and for a female, you have a lump in the breast or have fibroids, have bulging disc. Of course, sooner or later getting worse. Hopefully you're not. And for some patient in the hospital, stroke, heart attack, it's like a bankrupt. The debt accumulated, whatever the principal plus interest accumulate to a point. So like the bank come to collect the house because you didn't pay the mortgage, plus interest, whatever, it's taken. That time, the credit is gone. So when the doctor tell you you're fine, they're telling you your credit score is fine, but they cannot determine how much money you have. We are different. As acupuncture can tell how much health you are in debt or how much we should save for you. That's a very, very unique thing. In my clinic or with any good acupuncturist or Chinese medicine should tell you. So first, we help you to pay back the debt. We treat your symptoms and disease, like type 2 diabetes. Second, we'll teach you or tell you why you got all this problem. Your lifestyle, your habits, there's certain thing. Keep on spending for your health. And by age, naturally, your saving or your payment for your health, which is your metabolism, is going down. Every single human being is like that. You're 50 years old, your metabolism rate is definitely less than when you were 20. And you still want to spend the same way as when you were 20. Your health go downhill. So that's a big part we talk to you. So we have diabetes, type 2. We have a high blood sugar level. You're not healthy. You're not weak. Don't talk about life quality. It's gone. In the beginning, you have some tension with symptoms. You're not. You're more than that. You have diabetes. You not only have a debt, you're officially being challenged for your credit score. And doctors give you some medication that's control the blood sugar level, like metformin. The drugs help a while, and they never think. So that's a quote from my patient a couple of days ago. I never believe it will happen to me. The sugar level went up. Doctors say, let's give me more medication. 1 medication, 2 medications, 3 medication. Finally say, you need an insulin shot. By the way, 80% type 2 diabetes patient has enough insulin, but your body not able to use insulin. That's the reason your sugar level went up. Then do you think have more insulin shot can help you? Even insulin cannot control blood sugar level. Boom, stroke, heart attack, kidney failure, blindness, everything happened. So I tell every single diabetes patient, either you walk into hospital or you're running to hospital. But most type 2 diabetes patients, in the beginning is walking, sooner or later, it's like a train go downhill, accelerate, start running, rush into the hospital. And we don't want that for you. So that's the reality. Unfortunately, once you're on the track for type 2 diabetes, unless you try to reverse, just like a train go downhill, unless you try to pull back uphill and stop it, otherwise that would be the destiny. That's the destiny for every single type 2 diabetes patient if you don't control your blood sugar level. Some people 5 years, some people 10 years, some people 20 years. Some people can manage very well, slow walking, even 40 years later. Still have diabetes, type 2, still have little high sugar level. By luck, nobody knows. But whoever on the track is on the track. It's like a warning sign for your car. The red light is on for your engine. It will break down sooner or later. You know that. So what are you going to do? No symptoms, especially for high blood sugar level, is a normal symptoms. There's no such a thing called normal symptoms. Symptoms means something wrong, just like your car. A yellow light is on, the red light is on. The red light is on is not normal. And your health deserves more attention than your car. So when my patient drive a Tesla coming and say, doctor, it's too expensive. Like, oh, I don't know. You want to pay $10,000 for your Tesla, but you don't want to pay $10,000 for your body? I don't know how much your health or your life worth. Okay, then let's talk about it. Why in Chinese medicine believe you got type 2 diabetes? First thing, weakness. We talk about it. Your metabolism rate goes down, your energy goes down. You're not able to process or spend for health like you used to. Second one called dampness. In Chinese medicine believe whatever left over or your body overloaded. That's the reason you have big belly. The third one called stress or tension. Anybody in the Bay Area, you know what that means. When you tensed up, you have poor circulation. And the sleep problem, I learned from my patient. In the beginning, when I treat them, everything's better, but the sugar level doesn't drop. And finally, I use a Fitbit to test them. I find out a lot of people believe their sleep is good. You believe your sleep is good, but we test your deep sleep, might not be. Once your deep sleep improves, your sugar level drop. So if you want to solve a problem, you have to know the cause. So if you come to my consultation or exam, I will check your body, check your pulse, look at your tongue, tell you why, which type is you. So let's talk about weakness. So when the body metabolism rate goes down, your circulation goes down. So like an engine, power is not so powerful. So everything slows down. And the symptoms will show as I'm tired, I have chronic fatigue. For a lot of type 2 diabetes patients, you feel nothing other than just fatigue. And if you want to check, do you have weakness, also coldness? Very simple. Touch your belly right above your navel. And then compare to underneath your armpit. For some people say, oh, it's the same. That might be because your hand are cold. If your hand is cold or your belly is colder, then you're under your armpit. Under your armpit is the lung. Your body cannot let your lungs, the body temperature goes down. The lung definitely need a guaranteed blood circulation. That's the place the doctor will check your body temperature. There, underneath your armpit. If underneath your armpit is more warm than your navel or below your navel, you belong to this group. Second one called dampness. You have big belly, straightforward. Too much eating like the testimony, Bill talked about it. That's the reason I ask him for skip one dinner every other day. We don't have crazy diet, by the way. We just ask you eat normal your body can handle. Even your 20 you should eat like that way. We want you eat the same as your 20, what you should eat, even if you have diabetes, and you will enjoy food. But a big belly might require some intermittent fasting. The next thing is sleep. I highly recommend you use a Fitbit, test your sleep before you come to see me. If your deep sleep is less than 1.5 hours, we have to fix your sleep before help your diabetes type 2 or your sugar level. The reason we have a sleep problem doesn't matter is sufficient, not enough sleep time, or your sleep quality is bad. Your body has no time to do the work for processing the sugar or the metabolism. Just like an engineer, always in meeting, how can he sit down, do the coding? That's what happened to your body. The last one will be stress or tension. Once your body tense up, your circulation slow down. You don't need any health problem. The tension in your body will cause insulin resistance. That's my understanding. Nobody proved it. Actually, insulin resistance is a concept. The doctor talk about it, but nobody can show you what literally it is. Like a virus or bacteria can see it. Insulin can see it. Insulin resistance, nobody know what it is. But from my experience, when patients talk about it, they have insulin resistance was like over 200 blood sugar level. We release the tension in their body, the sugar level drop 50 points, 90 points, one visit. But you need a more to establish the outcome. But a one visit can drop so much, indicates something happened inside your body with the insulin resistance from the tension. This one, if you come do the exam, I check your body, you can tell, oh, this muscle is loosened, but that muscle, why is so tight? A lot of you are on medication already, like metformin. But now, in the whole United States, a lot of type 2 diabetes are insulin dependent. The more insulin you use, the less your body will produce itself. The more you use insulin, the less your own body will produce insulin. So like a 30-year-old man, if the parents give $1 million, why I need to go work? The more you give him money, the less he want to go work. Same thing. If you spoil your body with insulin, your body won't produce insulin. And all the other medication, whatever you are taking, all have side effects. And I highly recommend you read the side effects before you take any medication. And the funny thing is, if you don't take drugs or medication as vitamins, supplements in the past, why you want to take a chemical stuff, which you know has a side effect and toxin to fix your health problem? You're taking a not healthy thing to fix a health problem. Is that funny? Logic-wise, it doesn't make sense for us, for acupuncturists at all. Okay, talk about why the reason caused the problem for your type 2 diabetes. Now let's talk about how we fix it. The first three types, weakness, dampness, and sleep problem, all belongs to low metabolism. The dampness because your body not able to process efficient. The weakness because your body doesn't have the power, so like engine, no power. And the sleep problem because your autonomic nervous system, the blood doesn't go back to your belly. And the belly is the place for metabolism. It's like two sides of the same problem. Sleep problem and metabolism rate low. The metabolism rate low and the sleep problem is side to side. I'm going to explain to you. So in Chinese medicine, believe if you want to talk about health, your blood need to go to your belly. Our brain is a central computer. Nothing produced for nutrition other than some hormone. Your arms and legs like big wheels of the car. Your heart is a pumper. Your lung is for oxygen. Every single thing physically or chemical-wise happen for your metabolism is in your belly. The food come to stomach, goes through your guts, get out. And your liver, your kidney, your pancreas, your insulin, everything, chemical-wise, absorb nutrition, detoxing, get vitamins, water back, recycle. Everything happen in your belly. And the only way you sleep, your brain shut down 70%, your heart and your lungs slow down 40%, the blood will go to your belly for metabolism. The only way you have good quality deep sleep, your body can efficiently only focus on metabolism. So that's the reason our treatment is focused on your belly. We suck the blood to your belly. And I'm proud to say 80% of my patients will take a nap in my clinic during the treatment, the very first visit. So most time you come in, we put needles, put a mox pot, which is a heating therapy on your belly. You take a nap. Next morning, get up, your sugar level drop. That sounds good. And in the past, I thought I can help patients because I help them with suck the blood to the belly. But later on, I find out one thing very, very interesting. A lot of patients stop seeing me a couple years already. They still have good outcome. And I finally figured out this because this nerve system, autonomic nerve system, anything you can control, you can lift up your leg or arm, you can move around. That's called sports nerve system. You can control. But in your body, for your blood sugar, your blood pressure, your body temperature, you go bathroom, all the things controlled by autonomic nerve system. And this nerve system has two parts. One called sympathetic, is on your back, is for spending, which means blood pressure go up, blood sugar level go up, you're ready to fight Another one called parasympathetic. It's behind your neck and your buttock, which is for sleep, immune system, relax, go bathroom, and sex. Remember the first case I talked about? The old man I treated for constipation? His sugar level dropped tremendously. In my clinic, if you finish a cycle, fall asleep, and wake up, we're training your autonomic nervous system because in a weird place, it's pretty noisy. The bed is not comfortable as home, and a strange place and can fall asleep. We literally stimulate through acupuncture, make this nerve system like go to gym, strengthen that. And by age, this nerve system control of your body always go down. That's the reason why senior always have trouble go bathroom, go sleep, whatever. It's because this nerve system control for your body is getting less. So if you stay here 3 months, every single visit you fall asleep, not only your sugar level drop, you go bathroom, feel better, your digestion feel better, your sex drive feel better, everything feel better. That's the reason. And I learned this one from my patient. Actually, that was the very beginning, the reason I got involved was treating type 2 diabetes. Actually, I'm very grateful for the first patient I treated. If not, accidentally I fixed his issue or helped his issue, I probably would not get interest in treat type 2 diabetes. I might be still think like type 2 diabetes is not treatable like a lot of people do. Many doctors, acupuncturists, herbalists does not believe type 2 diabetes can be treated. That's one thing very interesting. Okay, you say, how can you raise up my metabolism rate or speed up my circulation in my body? This is the herbs we use. The left one is the raw herbs. Even in Bay Area, it grow. And in China has been used over 3,000 years. The middle one is the rabbit, only take the fiber out. That's how we use it. The right side, the top one is non-smoking one. The bottom one is called moxa roll. The treatment actually called moxibustion like this. We used to use the herbs just burning a pot, but now we do like this. Pre-cut to around 1 hour, putting a pots. They use a cotton mask, wrapped up the pots. In case you fall asleep, you turn around, then the pots will drop. And with the mask tied up, it won't hurt you or burn you. So moxa with acupuncture is the one help your belly circulation and help your metabolism rate. And for tension, we do one thing called tension release. Tensions, we have type 2 diabetes. We will check the tensions throughout your body. And with that tension, we do tension release. Just like a holding fist. We try to open up the hand so you have better circulation. Very simple, just like the hose in your backyard. You step on it, it's called tension. You let it go, the water flow. That's what happened for the circulation of your body. And I personally believe, again, when we release the tension, your circulation is better. That one help tension, help insulin resistance. But this one is a treatment one-on-one. Because your whole body, everybody is different. I have to focus on you in 1 hour to release a whole acupuncture channel. So kind of unblock whatever the blockage of the circulation, and your body can bring oxygen to whatever the cells need. So that's one thing. So finally, the conclusion, mox plus acupuncture. Every single visit in the clinic, you fall asleep, train your autonomic nerve system. So your body's nerve system internally control for internal organs will be strengthened. And tension release will unlock any tension in your body, so circulation itself is much better. And herbs is optional. If you want to take herbs, it's free. It's bonus. If you don't want, you don't have to. All the video testimony you heard before, I remember only one took herbs, but not for type 2 diabetes. So the last one would be the conclusion. What you want to do after today's seminar? There are 3 types I saw in my clinic. The first one is I don't want to look at it. Do nothing. Of course, complications will happen. You have no cost, but it will ruin your life quickly. And sooner or later, you will spend money for copay. If you never know, the insulin copay for your insurance can be up to $600 every month. The insurance pays some, you need to pay some copay. Once you are insulin dependent, every single month, your copay might be $500 to $600. And this is a quote from one of my patients, and I think she might be here today with us. She literally said, and actually I heard this one again, that's when I quoted, I never believed it would happen to me. I'm on medication, the number is good. Suddenly it shoot up 200, or doctor say you need another medication. Either have more drugs, sooner or later will suffer the complications. Even the insurance pay the majority, and you might pay some copay. But your life quality, your career, your age, whatever things, be big trouble. Or you have to look at what's going on with your health. Again, your body is the first wife or husband you marry from your born. Now when your body husband or your body wife, this very one inside has been abused by you to achieve whatever outside your body for decades. Today want to have a communication with you through type 2 diabetes. Most people, if you're first generation in the Bay Area, you work hard. You use your body hard. So one time I talked to one of my patients. I say, if you use your husband, work hard, never talk to him, never feed him, whatever he wants, you don't want it. You don't want to listen to it. What's going on with your marriage? She said, my husband would divorce me. I said, that's what happening to your body. That's how you treat your body. So if you want a better solution, of course, alternative medicine. Doesn't matter, Ayurveda, acupuncture, herbalist. Anybody can help you. It can postpone. If you do enough, it can reverse. If you do more, you can get health. Of course, it costs you a lot. Unfortunately, no health insurance cover for diabetes for acupuncture. But the outcomes is your health, your beauty, your family. You can be around with your kids 20, 30, 40 years and prolong your career age. I have a patient ready to retire 5 years ago. When she told me, should I sell my business? She's financial planning. I said, no. Wait 3 months. If you're not better, sell it. If you're getting better, don't worry about it. 3 months later, all symptoms stopped. 6 months later, she was back before menopause. 3 years later, she tripled her business. At her 60 years old, she talked to me. She said, everybody think I'm 40. My health is better than when I was 40, literally. So if you spend tons of money, go restaurant for beauty, for supplements, like Chinese, Indian believe there's some miracle food can help your health. Why not for your health? So that's your choice. No cost. Trust the doctor with drugs or spend money for your body. So our goal is to lower your sugar level, prevent all the complications, regain your health, and maintain throughout your life. So how much you want to do, the program is up to you. The first one called Patch basically will reduce the depth for your health. You can do home therapy, you can do long distance, you can do MOX at home. It will help. I have a patient from 220, the sugar level dropped to 150. That won't drop anymore. And she asked me, I said, long distance, I'm good enough to help you a lot. Even if it's 4 or 5 months already, you have to fly in. There's an option if you can come in every month from long distance, 3-5 days, 3-6 months, you still can see excellent outcome. But that will be every day, 2 times tension release. It will drop your sugar level, but nothing guaranteed. Second one is let's focus on the problem, diabetes. Not only pay back the debt, we teach you diet, exercise. You need at least 10 sections for tension release. The goal is in 3 months, bring down your sugar level to pre-diabetes. And if you have drugs, medication already, you might need 6 months. Because drop down the sugar level was not a hard part. Once we drop down to pre-diabetes, 110, 120, and we get rid of your medication, the sugar level will shoot up. That's the harder one to treat. You might need 6 months or even longer. The goal is normal sugar level, lose weight, improve sleep, and hopefully it'll teach you a healthy lifestyle. Of course, you want to do, say, doctor, I want to rebuild my relationship, my marriage with my body wife, my body husband. Then you go the most comprehensive program. You need to do 30 times tension release. And we're going to monitor all your health for 12 months. And then you have quality of life, much better energy. Most people tell me their sex life, their appearance, they look younger, they're more energetic. Every single thing in your life will be improved. So that's our best program. So we're going to offer you a gift of our health for a free consultation exam, but you have to come in this week. If you come in next week, we're going to charge you 50%, which is $150. If you come 2 weeks later, we're going to charge you full price because 90% chance I have to repeat whatever I said today. It's wasting my time. An exam would be most thoroughly you have ever in your life. The reason in Chinese medicine, we touch your body, we check your pulse, we look at your tongue. When you see an MD, hardly anybody touch you. It's not a doctor seeing you. It's the lab test check you. Have you ever seen an MD check you? Unless your leg broke. Most times they just order a bunch of tests for you. So we're going to spend at least 20 minutes, half hour, up to 1 hour to check your body, talk to you. This muscle is loosened, this muscle is tight. Do you feel it? Yes. And there are certain acupuncture channels tight. You are like that too. Yes. We check your belly is cold compared to underneath your armpit. Do you feel that? Yes. Look at your tongue. The top one is cut off. That indicates your sleep is in trouble. Do you agree? Because every single thing I try to teach you, understand your body through my exam by touching your body. So I try to be a marriage counseling. I try to be a marriage counselor for you and your body. You married to your body, not me. But I try to counsel you to understand this is your body's complaint. This needs to be taken care of. So you have a good marriage with your body. That's the exam we're going to do. So if you join our exam and you sign up the program, we offer you a satisfaction warranty. In the first month, if your sugar level doesn't drop, we either full refund, no question asked, or you can continue your treatments. Doctor, I feel my digestion better, my sleep is better, but my sugar level is not dropped. How much you drop, we're going to talk about based on your sugar level in the first exam. You can continue treatment until you drop to the number I promise you. That's my satisfaction warranty. Fortunately, I offer from last July until now, 4, 5, 6 months already. Nobody ever got it. Most people in 3 to 5 visits, sugar level dropped already. Why I give you this gift? I don't want to worry about money. I don't want to, I don't know, this work is weird. I never try needles. I want you to come try my treatment. See how much the pain. for needles. Most people feel if you can fall asleep, it's not a huge pain. And Mark's healing therapy, very comfortable. And tension release, we're going to explain to you. You understand what's going on, how we are going to do for you and approach it. The final message, diabetes is not your problem. Doesn't matter type 2 or how high the sugar level. Your problem is how you treat your body in the past and how you are going to treat your body in the future. That's your choice. Okay, that's the seminar for today. Anyone you know have type 2 diabetes, I hope we can invite them to join my future seminars.
Doctor, I'm here if you want to talk about my case.
Okay, I'm going to stop here. I'm going to ask one of my patients right now in my clinic to share her story because time is a little over. Sorry for that. Go ahead.
Hi, everyone. I am a new patient at the doctor's practice. I got to know about doctor's practice through the radio and Body 92.3 FM, and I signed up for the consultation that the doctor was talking about just now. And during the consultation, we went over multiple things that I could be doing, and I was also very scared of needles, and I didn't know what was going to happen. But just based on the questions that you have in the chat right now, till now, I have not been prescribed is in the office. Doctor puts the moxa pots and the acupuncture needles. And I want my first appointment, I had my blood sugar was 170 fasting, and 5 visits later, it came down to 130 fasting. And that's in a span of 2 weeks. I would say the primary contributions to that was the tension release that the doctor was able to do. I had 1.5 session of tension release that truly helped. The following days, the numbers just plummeted and I couldn't believe it. And also the kind of diet recommendations that the doctor prescribes, which he will talk about in the initial consultation based on case-by-case basis. So that one truly helped me. Just to give a little background, I am of Indian origin. I grew up in India, and I have been overweight from 8 years of age. And I remember at least from 8 years of age being significantly overweight. Elementary school, I was the moti, I was the fat one, and all the bullying and everything. And it's just, I took it as part of life. I thought, okay, I'm going to turn 20 and I'm going to become this ultra model looking person somehow overnight, which, a spoiler, never happened. My parents kept constantly testing me for some issue or the other. They didn't know why I was having high body weight. They kept testing me for thyroid, which always came back as negative. And along with thyroid, I remember that my fasting blood sugar was in the normal range, but always elevated. And this, at least from puberty, was always the case. Fast forward to when I was 20, 25, I was diagnosed with PCOS, which when I asked the doctor what is the case, they said, oh, it's because of insulin resistance. I said, okay, what is insulin resistance? What do I need to do? What causes it? We don't know. We don't know what causes insulin resistance. Okay, great. What do I do to undo it? Oh, cut out all carbs. Forget rice, forget potatoes, forget starches. I was prescribed keto diet, which I honestly think is the single most torturous thing on the planet. And they said, you can go on birth control and come back to us. Let's do IVF whenever you want to have kids. That was just, I don't know. I didn't, back then, of course, I wasn't thinking about a family. I wasn't even married. I said, okay, I'm not going to do any of this. I'm just going to keep my eyes shut and let this figure out when I get there. I get married. We want to start a family. Obviously, I'm not able to do that. And at that time, my husband and I, we almost went to a point of considering IVF or adoption. And that's when I thought, why not give traditional medicine a chance? And at that time, honestly, I did not come to this doctor. I went to India. I went back to India and I went through homeopathic treatment with some medication and mostly lifestyle changes. A lot of lifestyle changes, very... they say hard work is overrated and consistency is underrated. I truly understood what that was when I went through that. We were blessed with a kid. I suffered through the pregnancy because of gestational diabetes. Again, they asked me to cut out all carbs. Being pregnant and not being able to eat was it was terrible. But my kid came out healthy and happy. And of course, when things turn out fine, we all tend to forget about what happened. My kid is a year and a half right now. Last November, my father, who just retired, he's 60 years old now, he got his first heart attack. And he has been diabetic from the time he was 38 years old. I'm in my 30s right now. And at that point, I don't know, something clicked. And I said, I'm putting this off for too long. I've always known I have high fasting blood sugar. I need to do something about it. I had gestational diabetes. Now my father had his first heart attack. This really cannot go on for much longer. And I am destined to go down the same path if I'm going to keep my eyes closed. At that point, I started monitoring my blood sugars. And that was when I found out I was starting out the very first day. I recorded 200 and something, 203, 204 in fasting, which I thought was not a number I would ever see in my life. But that was there. I slowly started making small changes, and with the doctor's guidance and with lifestyle changes, today I am on a good day. I touch 120s. Otherwise, I am in low 130s. And it has truly been life-changing. And I would say if your guys are here, do consider it, give it a shot. You really have nothing to lose. At least come for the consultation. If nothing, you will get to know what sort of a diet you should be eating and what the philosophy behind it is, which will make your health better. Thank you.
Thank you. Do you mind to mention one thing, like you even eat potatoes, enjoy food?
Oh, yes. Potatoes are a constant in my life right now. I eat potatoes every single day. I eat potatoes for dinner. I do not cut out starches after the magical 4 p.m. or whatever. None of those things. I eat everything. It's all healthy food. It's all homemade. It's nothing gimmicky. It's nothing that nature doesn't give you already. Yeah.
Okay. Thank you so much for your time. Okay. We're going to open for question right now, actually. So if you want to sign up for a consultation, feel free to put it in the chat. And everybody probably interested to know what's the cost. It's from $3,000 if you do home therapy up to $20,000 for 1 year program. And how long will see the improvement? 3 to 5 visits. And can type 2 diabetes can be cured? No, but it can be complete reverse. It's like money. We give you $1 million and say, can I be rich forever? Depends how you spend it. The $1 million we're talking about is for your health. So that's why we teach you the lifestyle change, how you can keep in rich condition. But 90% chance you can keep on your own. But if you have 3 kids or you have VP, you're super stressed, you might need to maintain treatment. We're not treating your type 2 diabetes by fighting your job or your life. That's a different story. So what after? I saw a question like, does that require lifestyle change? Yes and no. The lifestyle change we're talking about is even for a normal person, even you're in your 20s, you want to be healthy, you have to do it. Nothing to do with type 2 diabetes. So that's one thing we talk about lifestyle change. Unfortunately, most people, type 2 diabetes, has some kind of wrong lifestyle. That's the reason we say you need to change your lifestyle. You need to change it back to the normal lifestyle or healthy lifestyle. So that's all the seminar for today. If anybody have a question, you can look in the chat for whatever time and just sign up a time or just text me. See, Dr. Wednesday afternoon, I'm free. Are you able to see me? So the phone number we changed to a cell phone during the pandemic because that time we closed down 14 months. So we're not able to answer the phone in the clinic at all. And finally, we found like the cell phone is much easier. So another question is like, what should we bring with us for this consultation visit? Nothing, just dress loose. Big shorts or big t-shirt, just bring with you. Come here, change. We will recently blood work result be sufficient? Yes. If you have A1C, at least we know what's going on. But I highly recommend you test your fasting sugar and post-meal 2 hours sugar level. Because I do have a patient told me the A1C fasting sugar like over 220 something. We did one visit and he tested because the monitor came in after. And his sugar is 160. And I couldn't get a credit because we didn't test the day before. But it happens, sometimes drop 50 points in one visit. Let you know my treatment is what your body need. Is the treatment only external, including acupuncture? Yes. Acupuncture, moxa. Moxa even doesn't touch your body. You can take herbs. It's optional. It's internal. You don't have to. No injections at all. No medicine. No drugs. Every single thing is natural. All the side effect is the pain you have when we put in needle. That will take it out. Will this treatment be supplemental to what is prescribed by the physician doctors? For sure. If you have a medication, I don't want to touch your medication at all, but I do want you talk to your MDs, say, I'm doing acupuncture, it might help me. Second thing, I have to monitor your sugar level. If I do a great job, and the medication also compress your sugar level, it will be double outcome. Then your sugar level might go too low. Then you have to talk to your MD to take off medication. It happens every single month in my clinic. So that will be the thing I hope you'll be aware. Don't stop medication on your own. Do not just rely on me. Whatever you are now, just keep that way. Let me treat it. If you're getting better, talk to your MD, cut down medication. How long after acupuncture treatment can the low blood sugar level number sustain? If you follow my instruction, it should last all the time. Just like I give you $1 million, don't spend. It will be there all the time. But we're going to teach you how to spend, how to save in the future. And then everybody know the A1C is like 3 months to test. So even like in 3 visits or 5 visits, like Bill give the testimony from 200 dropped to 99 in 16 days, but he's still on the program for 3 months. 3 months later, you can test for A1C for the past 3 months. So if 3 months later, your A1C is still normal, you are completely reversed for your type 2 diabetes. That's up to your lifestyle, how stressful you are, how busy, your sleep, your diet. We're going to tell you what to do, everything. Just like a car will fix for you, we tell you, change engine oil, do turn up every 60,000 miles. Don't overspeed, don't overload it. If you do well, you should keep that condition for a long time. How much longer? The longest for my patient right now is 3 years. Come back, still normal blood sugar level. So are there no side effects to inhaling moxa smoking? Yes and no. And some doctors believe that smoking also help for some disease. But in my clinic, if you come in, you will see the fan system. It suck all the smoking out. And we have something covering your bed. So you might have a little smoky here and there, but not a lot. And most people walking into my clinic, you don't even smoke. You don't even smell the smoking. My email says the cost is $2,000 for the first month's 13 visits. In 13 visits with $2,000 cost, if your sugar level doesn't drop, you can get a $2,000 full refund. For example, you have 180. We talk about it like 130 or 140, 40 points drop in the first month. Would that be good enough for you? You say, yeah, it's reasonable. You pay $2,000, we start treatment. 1 month later, it's Doctor, it's only 165 or 150. Sure, we refund you. Or you say, can I just continue treatment? I feel so many things better. Can I treat until you drop to 140, 150, whatever I promise you? Whatever I promise, the number is based on exam. Everybody's different. Some people need a lot of attention release. Some people are just weak. Over the body is okay, just metabolism rate is low. Then your choice, 1 month later. So far, I never get anybody get the $2,000 back. That's my confidence. I'm so confident to say that. Thanks for Sumei. Thanks for the thanks. Is sweetener or sugar-free any better than regular white sugar for daily coffee, tea? That would be part of the diet program. If you're not on my program, it's $800. We talk about all the details, what you eat, what's going on. And we're going to monitor your diet for 8 months. You can send me the picture or send whatever you drink. We'll tell you yes or no for every single thing. But we're not going to cover that. You want to know a little basic? There's 2 things I recommend. Number 1, go to my website, diabeteswellnesscare.com. There's a lifestyle change videos, talk about sleep, diet, exercise, and stress. So go to the diet picture. We have a lot of things we talk about it. You can follow that. Second thing, make it very, very simple for every single one. If you want to go a healthy diet for type 2 diabetes, there's one thing called whole plant-based diet. Basically, anything you eat are real food, not a canned food, not processed food. You want to watch a documentary, it's called Forks, the forks to eat, forks over knives. The knives cut. Watch that video, give you a lot of insight. But if you join my program, the $800 diet program is free. And we also have a exercise class to help you speed up your metabolism. Very simple, very easy, and also help neck problem, lower back pain. That one is in person is $800 too. For a year, every single month, we have one gathering. Not because COVID is over. But if you join my program, it's free too. But that one, all the detail, we're going to give you a sheet when you come in for a consultation. Okay, next question. If after visits, our sugar level drop and I cut medication, do we keep continuing acupuncture and your treatment for life? No. Most patients I saw 3-6 months later will stop. And I rather see new patients for blood sugar level drop. Rather see you, we have normal sugar level. But a lot of patients will stay for beauty, for body shape, like women, their body shape 60 look like 30, 40, or for skin, for their bowel movement, for sleep, for whatever reason. But that's different program in team program. Once you get it done, you trust me and you appreciate your health. Let's talk about it. We used to open to called VIP Platinum Health Program, but this year we're going to close down because we're too busy for all the treatment for disease. Personally, I believe you shouldn't do treatment for your health. Like financial planning, you should save money instead of trying to pay back your debt. But for my level, I'm too busy for fix the problem now. So that one, we come in, we can talk about it. Is the cost $2,000 to $3,000 for entire treatment? No. Start from around $3,000 for home therapy, 3 months program, and the first month is $2,000, and it's up to like $20,000 for a year program, depending on what you want. You just want to get some improvement. I have medication, but my number is high. I want to bring down with medication, with the drugs. Then it's called patch, which get the sugar number down. 1 month, 2 months might be good enough. Is it no? I want to complete reverse. No medication, normal blood sugar level. It's called fixed diabetes. It costs you from $9,000 up to $13,000. The 3 to 6 months program. You have medication, 6 months minimum. You have no medication, 3 months might be good outcome. You say, no, doctor, not only I fixed the diabetes, like a fight with my wife. She wanted divorce. We just need to calm down this issue. Or you want to rebuild a relationship. It's a much, much bigger project. But the good news is once you finish the program, if you want to stay on the program, we'll give you 50% discount. So add a couple $7 for the rest of 6 months. It's like 30 or 40% cost for the first 6 months. No insurance cover for diabetes because nobody recognizes acupuncture for diabetes type 2. If you have insurance cover for acupuncture, you can call them and we can do courtesy for the first exam to verify for you. We have an insurance lady. What we can do is we can give a super bill. You have to come in to name any pain, neck pain, lower back pain, which is covered by insurance company. Now we'll give you a bill, whatever amount you paid. You just need to say, I have neck pain. Then we'll put an extra needle for neck pain. You bring that bill sent to insurance for your reimbursement. If you want us to help you, we'll have a lady charge 18%, whatever insurance bill come back. So the 18% pay the insurance lady. And with whatever, because they need to write a note from you, your neck pain, whatever, you talk to her. We don't take care of that. But there's an option. This is a kind of gray area will help you as courtesy. But literally, I don't write any paper because I'm treating your diabetes. So that's kind of doable, but I don't recommend. So thanks, everybody. Does the last question, does gut health affect your blood sugar level? Yes. It's not only gut, it's the whole circulation for your belly. Gut is part of it. So literally, when we do treatment, I have one lady, we did a very first treatment, and then she had like 7 to 8 bowel movement the next day. Not like tiny. It's a regular, almost close to regular, 7 to 8 bowel movement. She asked me why. I said, it's old stew. That's the reason why you're overweight. So a lot of you, or people overweight, you eat today, you go bathroom, you not poop out next day. You poop out 5 days ago, the food you ate. Chinese medicine called old stew. So gut health definitely is a big part of your sugar level. It'll be covered in the program. So I always joke like we buy one, get like 10 free. Like your energy, your sex drive, your digestion, you go bathroom. Used to be half hour, now it's like 5 minutes. Things like that always happen where I enjoy food, whatever. Like tennis, I used to play 1 course of tire, now I can play 3. That's all bonus. So that'll be the thing, or brain fogs, whatever, things like that. Because when you're healthy, so like when you have money, you will buy a car, you will fix the house, everything. So that's the thing. Text us again. Whatever time you good or whatever time you want to pick up from the list we have. We're going to open tomorrow and Tuesday for any consultation. And if you want to do a treatment, we might be able to do the first visit for you. Just dress loose, put in normal clothes or dress warm, come normal, come in, and bring a big shorts, a loosened clothes, and ready for treatment after exam. So the first consultation is complimentary. You don't have to pay for the consultation. If you do treatment, that will start count for your whole program. But if you don't make an appointment within this week, next week we're going to charge you 50%, $150. 2 weeks later, we're going to charge you full price. Because the longer you wait, the more I have to answer your question during the consultation. If you come in tomorrow, 90% chance we don't have to repeat a check. You know what I'm talking about. Because my time is precious. I really appreciate everybody coming for the seminar so I can talk to a group instead of every single one have to repeat the same thing. That's the reason I'm willing to give you the consultation. I spend 1 hour, 2 hours with you, but I don't have to spend 10 hours with 10 patients. You save me 8 hours time. That's the reason I give you the complimentary consultation. My regular fee schedule is $600 per hour. For consultation, I give 50% discount, $300. But most time my patients by referral, they walk in, I don't even talk to them. I just treat them. I even have patients flew in their parents from India for treatment, stay here 6 months. So that's the thing. If you first time know me, you heard a lot of story in my clinic. And feel free to ask anybody you met. you will meet in my clinic. Most of them were willing to answer you what's going on. That's one thing I like Indian people. You're willing to help other people by telling them what's good